Meet Jamie Halim, a 42 years old male elementary school teacher. Jeremy is bilingual, fluent in both English and Malay. He currently lives alone in an urban apartment setting. Medically, Jamie has a 5-year history of moderate persistent asthma, which is actively managed. He has known allergies to dust mites, pollen, and animal dander, which can sometimes trigger his asthma symptoms. Jamie is a non-smoker, which plays a positive role in the management of his respiratory condition. Given his profession and living environment, it's important to consider both environmental and occupational triggers when assessing and managing his asthma. Ongoing monitoring and tailored treatment plans are essential to support Jamie in maintaining a healthy and active lifestyle. Jamie Halim presents to the clinic with increased shortness of breath, chest tightness, and wheezing that has persisted for the past 3 days. He reports that these symptoms are particularly worse at night and during the early morning hours. Based on the clinical evaluation, Jamie is diagnosed with a moderate persistent asthma exacerbation. Hello, good morning. My name is Abdul Azif bin Abdul Malik. I'm a nursing student from UNIMAS. So today I'm going to teach this patient on how to use peak flow meter. So the nursing diagnosis is deficient knowledge related to lack of experience with peak flow monitoring as evidenced by verbalization of uncertainty and improper technique. So for the long-term goal, client will use a peak flow meter consistently and accurately to self-monitor respiratory status, reducing risk of severe asthma attacks. For the learning objectives, so client will identify the purpose and components of the peak flow meter. Next, list all the steps involved in proper usage. And next is demonstrate correct techniques and charting of results. Hello, good morning, sir. May I know your name, sir?
My name is Jamie.
Alright, so my name is Abdul Azif. I'm a nursing student from UNIMAS. So today I'm going to teach you on how to use peak flow meter since you are on nebulizer medication. So this device is used to measure your peak expiratory flow and also to detect early narrowing of airways, and also it helps to guide any treatment decisions regarding your conditions. Okay, so this is the device. We call this peak flow meter. So it has meters on this, and you need to blow from this mouthpiece. Okay, so the steps to use is to use this peak flow meter. You need to reset this meter from 0, and then you need to, it's either you may sit like this or you stand like this. Take a deep breath and seal your lips around the mouthpiece, and then blow as hard as possible. Okay, and then repeat 3 times, and then we choose the best result among of them. Okay, so for the normal range for adults is between 400 and also 700.
Yeah.
So, but you need to be aware if when you blow this peak flow meter, but it does not reach more than 50% of your personal best, which is it must be between 400 and 700. You need to seek any medical attention that near to you for further checkups.
Okay.
So when to use it is since you are on nebulizer medication, so you need to do before you start your nebulizer session, and also after your nebulizer session, pre and post.
Okay.
So yeah, that's it.
Okay.
So this is how to clean your peak flow meter. First, disconnect your mouthpiece from the peak flow meter. Ready an alcohol swabs. Wipe around the mouthpiece. Wipe it thoroughly. Make it clean to prevent any dust or pollen. And here we go. be good to go. Okay, Mr. Jamie, so now I'm going to teach you on how to use this peak flow meter. So I will give this to you. Look at me first, and then I want you to repeat the same thing. So the first thing first, you need to reset the meter from anywhere to 0, and then you may do this peak flow meter monitoring by standing, or also sitting like this. So next you need to take a deep breath, seal your mouth at the mouthpiece like this, and blow as hard as possible like this. Like this.
Okay.
Which is normal because the range is 400 to 700. So this is 450. Okay. So can you repeat, Mr. Jamie?
Okay.
Reset the meter to 0. Okay. And then sit comfortably or stand. Next is take a deep breath, seal the mouthpiece, and blow as hard as possible.
500.
Which is a normal range. Okay.
520. 540.
So we choose the highest one, which is
540.
Okay.
Within the normal range.
Alright, thank you, Mr. Jamie.
Welcome, Mr. Wazi.